We were here 2 weeks ago when we raised concern that the public servants, the civil servants, doctors included, for a very long time have been enjoying comprehensive medical cover. But then when NHIF was changed to Social Health Authority, they stopped enjoying this cover. This was not a privilege. It was out of the stoppage or relinquishing the medical insurance or the medical allowance of the public servants that they were enjoying these particular covers. So yes, the civil servants and public servants have been paying medical allowance to NHIF and again paying the statutory deduction. Last year, from 1st of October, when SHA came into effective fully and NHIF became de facto, we had a meeting with the national government and agreed that the services that we were enjoying from NHIF, the comprehensive cover, will then be covered by Social Health Authority. But this only happened for a few months. The whole part of December and part of this year, our members have been complaining. We've seen doctors who are offering services being detained in the hospitals because the comprehensive component of the Social Health Authority is not working. We complained about this 2 weeks ago and then it worked for 2 days. We are back here because we have many civil servants, we have many public servants, we have many doctors that as we speak now cannot access both public and private services using Social Health Authority. Yet we have been faithfully paying the medical allowance which we relinquished and the statutory reduction of 2.75%. When we tried to ask Social Health Authority why this is happening, then they said that employers, which also is government, has not remitted to them the 2.75% that have been deducted. So a government deducts the money from the employees and say that they have not remitted to the government, and therefore the government decided not to give services to the workers. So as we had promised earlier, we are not in a begging mission. The access to health care for doctors, for public servants, for civil servants is a right. And the fact that it's not a free service that we are asking for, but it's a service that we are asking based on the finances that we have been deducted. We have resolved, both as Kmpdu and as UKCS, that next week on 18th, we'll have a mega demonstration from Kenyatta National Hospital to Social Health Authority to put petition there. And then we proceed to the Ministry of Health, then we'll proceed to the Ministry of Public Service, and then to Treasury. And then we want to ask the government, both the national government and the county government and Social Health Authority, the ineffectiveness in management of Social Health Authority should not be our problem. The ineffectiveness in running the government is not our business as workers. Ours is to do our jobs as we have trained. And therefore, if there's anything that is interfering with that, we can't allow. Therefore, this time and in this moment, the action that we're calling for on 18th is not only for doctors, it's for all the civil servants. So we're expecting the Huduma centers to be closed. We are expecting those in different offices that are serving different services to be out, because you have to choose whether to be in those offices where you are underappreciated, where you're not valued, or to be in the street to ensure that this money that is being deducted for you, you can access health care and your family can access health care. We have learned time and again that the government do not give in to issues when they're begged. We've learned that it only happens with demonstrations, with protests. And we've also discussed together with the UKCS as Kmpdu that if these matters are not resolved, we are not just going to resolve to just demonstrations and protests. We are actually going to issue a strike notice on that 18th and proceed on strike, which will involve all the doctors and all the civil servants. That is what we are demanding, because there is no way we are going to continue begging where the government is very busy deducting money from us, extracting money from us, and they have no any intention to ensure that the Social Health Authority is working. Thank you. But I want my brother, Dr. Kaura, to add something, and then Dr. Miskela. We have open for questions.
Well, thank you. As you've heard, we as civil servants, do not have a functional health cover. What is expected by the employer is to make remittances to the Social Health Authority. But the employers keep to say they have no money to pay the requirements of SHA. And that means if you don't pay SHA, we as civil servants, we don't benefit on any health benefits. And that's why we're giving a notice to the government that next week on Tuesday, together with the Union of Kenya Civil Servants and all other public servants, we want to remind the government that we are workers whose health matters. And we cannot keep on to attend to our duties when our coverage is not functional. So that 2.75% needs to be paid to SHA for SHA to continue working. Because if it's not going to work, we're all in this mess. And we don't want to suffer a situation whereby we have to use our own good money to pay for healthcare where monies have already been deducted. So that deduction must be paid to SHA. And the notice is counting to next week on Tuesday. We'll be on the streets to give a notice to the government. Thank you.
Yeah, so it's been a really sad past 2 weeks for me because I gave myself the duty of handling our members' complaints around the comprehensive medical cover. And I've found myself really in trouble with the membership because I have a colleague who had a baby admitted at a hospital in an ICU. And he could not even get the admission, first of all, because he was told his cover is inactive. Another lady from the Ministry of Health, another senior doctor, went to Aga Khan, also turned away. And when they printed, the reason was non-payment. Another doctor has cancer in Meru, was due for a procedure in one of the city hospitals. Could not get them. Didn't have $1 million for that because there was no cover. We had to fundraise. And the last one was a doctor in Kisii whose baby just came out of theater, and instead of her worrying about her little child, she had to worry about how that bill will be sorted. This is despite the fact that above and beyond the 2.75 that we pay, averagely most of our members pay around 9,000 shillings per month for shift. Above and beyond that, they pay another 6,000 shillings every month from the medical allowance to the public officers' medical fund so that they can get an enhanced cover beyond what shift offers. But lo and behold, despite paying twice to SHA, they are not able to get the services because SHA decided that they put a system in place that every 9th of every month, when the employer has not remitted the money, you are suspended from the service. So when you reach out to SHA, they tell you, reach out to your employer. Look here, Kmpdu and all its members are debt collection agencies. SHA is government, Treasury is government, everybody who collects our money is government. Then why is there that the government deducts money and does not remit to the government, and then the same government denies you the service? You had the governor of Makueni berating the minister yesterday about SHA not working. Shame on him. They are the very, very people in the counties who deduct money from us and don't remit to SHA. SHA don't pluck money from trees. And as Kmpdu, you are saying that our members will not have to pay with their lives or have to sell anything to get cover that they deserve. As Kmpdu, you're not going to be there calling counties and employers to do their work. If they can't remit the money on time, then let them SHA open up that system so that whether they are paid or not, we get our services. As simple as that. And it's a demand. And we have to ask ourselves that what is happening in this country? Look at the police. They are paying for services that they can't get. You saw the clips going around where you're somewhere protecting Kenya in Mandera. Your poor wife is in the village with your child, they fall sick and they can't get the cover. As you stick somewhere in the middle of nowhere, serving this nation. Look at the teachers, those who have died, those who have complicated. because there are characters in this town who have put profit over lives. And so, I want to tell the government that our members and the civil servants, we won't be engaging in procuring private insurances because the public insurance has failed. We'll simply stay at home. As simple as that. We will simply stay at home. So Kenyans, let them know that come 18th, we'll begin our demos. But soon after, we'll be going and staying at home because clearly we are serving people who don't care. And you hear the MPs jumping all over the place telling you how SHA is working. The minister jumping all over the place from one station to another saying how SHA is working. But when you ask her, has she ever used SHA? No, they have very, very nice private covers. If SHA is working, why don't they use that SHA they keep on talking about? And to the president, he keeps on saying that it will work, itakuwa sawa. Life can't wait. Once you are dead, you are dead. Once a limb has been broken and not fixed and is amputated, it's gone. Limbs don't grow again like the lizard of a tail, a tail of a lizard. When a kidney fails and you can't get it fixed, you're gone, you're going to dialyze forever. A diabetic who can't get the eye fixed is blind forever. So don't tell us that you're going to wait. Wait till when? And we are tired of watching Kenyans die. But more importantly, we are tired of watching ourselves die for a government who does not care. Thank you.
Just to add it on, is that we have noted that there are many counties, almost 40 counties out of 47 counties, that are deducting from the pay slips of doctors and of workers and not remitting even to the banks and to SHA and to all authorities that have deducted. We are putting them on notice. This month we've been having 5 strikes in Kisii, in Kilifi, in Nairobi County, which is still ongoing, in Migori, which is upcoming, in Siaya, that was recently just averted. And we are saying we will actually have strikes in those particular places because there's no way you will deduct money from individual workers and then you don't remit. I know counties will say they have not got exchequer from the treasury. We want to say that is none of our business. Yeah. It is their business. Lastly, you've seen many political leaders, politicians, everybody saying that SHA is working or it will work. Is it that only the patients are mad to come out and say they've gone to these hospitals to visit them and they can't get the services? And by patients here, I mean even the doctor patients who go to the hospital don't get the care. I mean the teachers who go to the hospital don't get the care. I mean the police who we are asking today to join us in the demonstration because they too cannot get the care. It can't be that SHA is only working for political leaders and not working for everybody, including the healthcare workers. And strange businessmen from Dubai and from all over the place. We are saying that we cannot keep on being told that we wait for it to work. We complained about it in 2023. We went to court against it. They have never listened and they will not listen because to them, SHA is a business of extracting money from the workers. SHA is business to profit a few individuals. So yes, as workers, as union, we will not stand and see that our colleagues, our members, and ourselves die when a few individuals are benefiting. Any questions?